To Dr. Aditya, I bring in all the wishes and greetings from Speed Medical Institute on behalf of all the faculty members for achieving rank number 2 in NEET SS in specialty of DM, rheumatology and immunology. Congratulations to you and best wishes to you.
Thank you, sir.
To start with, even before I start, and this is the third interview I am making with Dr. Aditya, for the reason that the first interview which was made was in the month of April 2021. In 2021 April, he got, at the time AIMS was there, a separate institute exams were there, so he got AIMS rank number 1. So April 2021 AIMS rank number 1, he joined DM super specialty of clinical rheumatology and immunology in AIMS Rishikesh. The reason he joined in AIMS Rishikesh is because that is the only AIMS that has rheumatology and immunology. And subsequently, he wrote ENESS in the month of December 2021. And in ENESS 2021, he got rank number 3. And subsequently, he has written NEET SS 2021, which was held in 2022 in January 10th. And in that, he has got rank number 2 in merit list. But actually, his mark and rank number 1 in the merit list are the same. The same score was same. Because of the tiebreaker, for reasons what means in the tiebreaker, he has been given rank number 2. And this is a history and a short history of Dr. Aditya. And from now on, what is that his plan and to do, we will talk to him. And just quickly summarize, AIMS 2021, NEET SS, DM, super specialty, DM, rheumatology, immunology, rank number 1, AIMS Rishikesh, followed by ENESS 2021, he got in the month of December, he got rank number 3, and NEET SS 2021 session, he has got rank number 2. So this is the summary of his achievement. And right now, Dr. Aditya is with us here. And in the last interview, 2 interviews, I have spoken at length, and he has also explained at length how to prepare and how to go through how all he has done. Now, this interview is going to be a totally different interview, and it is to understand what runs in his mind and how is he going to take things ahead. Okay, over to Dr. Aditya.
Thanks, sir. I like clinical immunology and rheumatology and both medicine also. And these exams are very competitive and the level is very high. So I like to write the exam and to keep improving my level and to keep learning more. So every time I have attended an exam, I always realize that there are some things that I don't know that I can improve upon. And I found it helps me clinically also. When I'm seeing a patient, a little complicated patient, then the fact that I have read extensively, it helps me a lot.
So, it is very clear that he is, constantly in touch with the subject. That means even after getting a comfortable seat, after rank number 1, comfortable seat, and still he has given subsequent 2 exams, and to just see how long he can keep hold of this his content in the working memory to the short-term memory, that is able to practice and to be updated on daily basis. It's very, very good. And because usually when we get a rank and we settle in a seat, and after that we relax ourselves and wait to again study and wait to again kind of go ahead with all this materials and all that. So, that is very unique of Dr. Aditya, and I want to know from him, and he, in between these slots, from AIMS 2021 to ENESS 2021, did he prepare anything? And from ENESS 2021 December to January of NEET SS, did he prepare anything?
Yes, sir. Actually, I used to study around 1 to 2 hours a day at most. But in between my AIMS exam and my INA-SS exam. So INA-SS, I was actually preparing for NEET SS because it had gotten postponed. So I had always wanted to write NEET 2021. So I thought INA-SS is coming in between, so I will use it as practice. So I kept that as my initial target and I finished the syllabus. And after the INA-SS exam, sir, actually I was a little tired. So I took some days off. Then I restarted studying around 20th of December or so. After INA-SS, around 21st of December I had started. So for around 2 weeks, 2.5 weeks, I again revised whatever I had studied, my notes, and then general pediatrics and all from the speed apps. So that is by that time I was quite used to the syllabus, so I finished it quite fast.
Okay. So, I mean, even after your AIMS first rank in 2021, still you are in touch with the app.
Yes, sir. Because actually I don't have that much. I'm from a medicine background. I've done internal medicine MD. So the pediatrics parts in NEET SS they used to go over my head. So I needed to understand the topic, and that is why I used to use the app for those pediatric rheumatology and pediatric general pediatrics. So that helped me a lot. There were 2 or 3 questions from pediatrics, and obviously they are very important in determining the rank. So I was like, I should concentrate on this as well.
Excellent. So, I mean, April 2021 AIMS, and when did you join Speed before that?
Then my MD had gotten over on 31st of January. So actually on 30 around in January only I had joined. Sir. So initially, yes, I knew I wanted to do DM Rheumat only. So I had studied in final year. But then there were some topics that are not there in Kelly's, and then there were some topics I was not that confident that just from reading of the textbook I will be able to compete with other people. And it's a very competitive exam, so I wanted to get that extra edge. So that's why I opted for it.
So, after immediately you finish your MD, then you joined in January. From January to April, almost 6 months, not even 5 months, 4 to 5 months.
4 months. Yeah.
4 months. So, I mean that you used to prepare full time, or how it was?
Yes, sir. At that time, I used to study around 8 to 12 hours a day. I used to study properly.
So you have watched all the videos. You're able to complete all the videos in the app.
Sir, like I told you, I was quite confident about some subjects. Like I have read Harrison quite extensively. Most of it I have read. So the sections that I have not read, those parts I used to concentrate upon from the app, and also the tables. There are this thing videos on tables from both Harrison 20th and from Kelly's. So those tables that I had read and I had understood them, but then when I actually used to revise the tables at around 2 times speed or 1.25 times speed, and that time you could cover a lot of tables very fast. So that used to help me revise. So that is what I used to do.
So you used to give, regular grant exams which are given on monthly basis. Are you able to give it that?
Initially, I gave, sir. After I joined here, like I told you, I had to start to do my work here.
Regular and giving exams, and after that, it is, a casual writing of exams probably, or probably you would have aimed for. See, your preparation was for a NEET or for an institute exam.
Sir, actually, thing is that in Rheumat, SGPJ is considered like the best center in India. So that is through NEET SS. So initially my plan was to take SGPJ. So I wanted, then you will get that usually if you get within rank 4 in NEET SS. And so I was preparing for NEET SS, but then I got the seat, then there is no bond, and I really like the environment in my hospital. I've worked here, I've done my MD also here, so Pai sir is, he's a mentor to me, so I really like it here. So that is why I'm staying.
So the primary aim was to go for SGPGI, and that's the reason why NEET was the option for you. And in spite of it, in between you got the seat, and now you are comfortable. Now you are feeling difficult to move out.
Sir, the thing is, SGPGI has 2 years bond, sir. So 5 years additional I will have to work. So that I want to do research also. I want to study more also. In my personal experience, I want to do this now. So.
Very good, very good. So, and probably your thought process was, if I would have given NEET, what would I have achieved? What would have been achieved for an SGPGI? How would have been reached that level? And internally, now you feel, okay, I am capable of reaching SGPGI for what I have prepared. Okay, fine. Now I have an option in remaining or staying back in AIMS or going to SGPGI. That is your decision. Am I right?
Yes. It is about personal satisfaction.
Yes, personal satisfaction.
Yes, sir.
I really appreciate. I'm telling you, this is one different aspect of a student's experience for past 20 years. I have not seen. This is the first time I'm seeing in the competitive entrance exam for higher medical education. and it is absolutely commendable, because one prepared for that and he is able to achieve it, and he has to test himself is able to achieve it, and he has achieved it. And then after that, what he wants to take further is in a personal decision on any individual, that I really appreciate for your efforts. So people should definitely take home the message that, I mean, once you determine mentally and you fix it, and definitely it will be able to achieve. I mean, that is for sure. Now, and to Aditya, I want to ask you that what is the message that you want to give to the aspirants? I mean, very clear thought process you had, very clear executions you had. Now, what is that you want to tell the audience?
Specifically for rheumatology, sir, the number of seats is very limited. So you have to give it all, your everything. So you have to, once you decide you want to do rheumatology, you have to be sure of it and you have to go after it. And see, it depends on luck whether you will get it immediately or there will be some gap. But you should not leave your, you should keep working towards it. And any time you spend studying rheumat is going to help you in the later on, because see, whatever you study now will help you later also. So this is basically like studying your course only. It is just prior to getting the degree. That's all.
Very nice. Correct. Very strong message you have conveyed, and that you need to have the passion for your specialty and start preparing for it and be in that. And anyway, you're going to read it. Better prepare now. Yes, very nice. Now it is just one question I have personally. From where you get this attitude, that means this mental strength, that to go on? I mean, how you get it? How you conceive it actually? I would just want to know.
Sir, I don't think of it like preparation. I think of it like improving my knowledge base. So it is the subject that I will work in my entire life. So it is something that is a privilege to study. So that is why I enjoy it a lot. That is also
very appropriate answer. I mean, it's not I'm saying, it is not I'm preparing, I'm just living in that. It is that my specialty, I'm giving the exam.
Exactly.
Am I right? What a way, huh? I really look up to you, sir. Dr. Aditya, I really look up to you. I mean, it's great. It's something very great, and you are an inspiration to. You will be an inspiration to many. Yes,
Thank you.
And time to thank. And at this juncture, and whom all you want to thank who built up your career so far, you can take your time and you can list. You can tell them.
Sir, obviously my parents, my sister, then all the faculty who have taught me in MBBS, MD particularly, Pai sir, and sir, all of my juniors also. They work under me, but they do a lot of work for me. So it is a big support to work with them. And then they challenge me also. They ask me questions. Sometimes I don't know the answer, so then I am forced to reevaluate my knowledge. So it is a privilege to have worked with everybody. But obviously, most of all, my parents and my sisters.
Excellent. So, and on behalf of the entire Speed Medical Institute, we wish you all the best and all the success to a great career in rheumatology and immunology. And Speed will love to have you as a faculty, as a resource person to teach the students who are aspiring for rheumatology.
Yes, sir, definitely. It will be an honor, sir.
Yeah, so that it will be a great inspiration, also learning the subject. Both together will happen simultaneously through your approach. So once again, a great career ahead of rheumatology and immunology for you, and for your contribution for the specialty itself, and also for the millions of life you're going to touch upon in this specialty through your services is going to be amazing and great. For all that, and advance wishes and congratulations to you. Keep going, keep inspiring us like that, and we will constantly keep in touch with us so that we will appreciate and will be able to realize the value that you have done. Yes?
Thank you, sir.
The best to you, and take care. Thank you.